Dear all, we truly believe in what we do in the process of international clinical trials. Most employees of our clinic have great experience in conducting oncological trials, and we know the experience of others. Many of our site staff has international publications and are aware of up-to-date innovations in clinical oncology. We know for sure that science moves around the world in quantum leaps. The question is whether we can manage to go together with world science and use advanced technology. We would really appreciate if we can. What benefits from it we can receive? I have already told you that leading countries show high results improving treatment efficacy in oncology. Patients live longer, patients improve their conditions, patients have less complications. All of it can be achieved only by using contemporary methods of treatment. Thus, we once again need to mention the only possibility in current situation, I suppose, to treat patients with up-to-date methods. It is not necessary for them to go to other countries in Europe, to Israel, United States or Germany, because the same or even better treatment they can receive here in Ukraine. It is possible due to clinical trials in Ukraine, and it can be done today. I would like to continue informing patients about their rights and obligations in the process of clinical trials. I want to remind that we believe you receive positive effects from international trials, but we need to understand that this is not an agitation. The decision about clinical trial participation has to be taken voluntarily. We do not put any pressure on possible candidates. Patients should consider all advantages and disadvantages, should think over and thoroughly check the document called Informed Consent Form for International Clinical Trials. Each time I meet patients, or sub-investigators meet patients, this document is given for examination. Patients are not limited in time to make a decision. Patients can consult with their relatives, doctors, or whoever they want, which is required by international laws. Patients shall have enough time to make a decision. We follow this rule. Patients will read Informed Consent Form. Please read it thoroughly. Patients can ask investigator or me any question, anything they might be interested in. We often explain in details the participation in clinical trials, and this is done not because we want it. It is because we follow international standards. As a principal investigator, as head of the department, I shall explain myself or delegate it to my colleagues the explanation about rights and obligations and the given rights. All this information is provided in details in Informed Consent Form. I will read some issues provided in Informed Consent Form. I think you are aware about it, but Informed Consent Form provides information about name of trial, international number, name of the company who conducts the trial, name of principal investigator, address of the clinic, telephone numbers of the corresponding authority offices. So, this information became available to patients. The following part of information explains the purpose of the trial, what the endpoints of the trial, what is to be cured, and what kind of results is to be received. How many patients will take part in the trial? What trial procedures will be performed for patients? Detailed information is provided also about prior examination, about diagnostic procedures, about methods and mode of treatment, about procedure and its consequent performance. Patients will see it in their own informed consent form. What analysis is to be taken, how often, where it will be processed, what are responsibilities, and so on and so forth. Another part of information explains what to do if the trial is completed, which is a very important issue. It needs to be understood that we're not an insurance company. We're not the clinic which provides a lifetime treatment and observation. Unfortunately, we do not have possibility to do that. But we have possibility to treat patients within international clinical trials. Trials can last few months or several years, and considering this, we agree, if informed consent form is signed, to treat patients according to protocol and according to international rules. The duration of treatment and treatment areas are presupposed in trials. This information needs to be explained to patients, because we cannot treat all diseases. For example, we cure oncological diseases, but patients may have some chronic diseases of heart, lung, gastrointestinal diseases, and these diseases are cured by family doctors. As per informed consent form, we can cure oncological diseases. Of course, information is provided explaining the activities after the end of treatment. Consent form provides information about the drug and mode of treatment, about possible advantages and disadvantages during the trial. Signing the informed consent form, the patient agrees that this may happen to him or her. Information is provided about adverse events and frequency of adverse events appearance. I think everyone has ever read drug administration guidance with the information about possible adverse events. Adverse events will appear, but patients need to know that adverse events respond to treatment. It is very important for patient to inform investigator about all reactions happening to him or her. It helps us to provide an effective medical care. For example, this paper provides all possible adverse events patient may have during the given trial. It is a very important issue. Why information is such thoroughly provided? Because all participants of international clinical trials and due to international laws are assured. The subject matter of insurance is that during trial some risks may appear. These risks are possibly related to unknown side effect of the applied mode of treatment. If this happens, this fact in particular is the matter of insurable event or considered being such. But if the patient has adverse event provided in the informed consent form, then this is not the matter of insurable event. For instance, during treatment, patient has diarrhea, which is an expected adverse event, or patient has increased blood pressure, which is also provided in informed consent form. If these events happen, then this is not a matter of insurable event. All this we, as investigators, need to tell patients. So I mentioned about possible adverse events and its frequency. I want to pay more attention to the fact that when patients see great number of adverse events, a question arises: how I, as a patient, can receive trial treatment? I want to tell you that according to statistics, the frequency of reactions and adverse events caused by drugs used in international clinical trials is 5 to 8 times lower than during administration of commonly used drugs. Generally, the quality of trial drugs is very high, and adverse events frequency is lower. But, as a rule, Even if adverse event appears once per 1,000 times, it will be provided in informed consent form. When patients read information about risks and complications and have some doubts, he or she can discuss it with sub-investigators or me. We should understand each other, because reactions can appear with different frequency and different degree of expressiveness. Informed consent form also tells about medical procedures in details performed during clinical trials. For example, computer tomography, ultrasound examinations, bone scan, biochemical blood analysis, urine analysis, etc. Even the amount of blood taken will be mentioned. During clinical trials, it is important to practice safe sex. And this is one of the patient's obligations to follow while receiving new drugs and for the duration of the trial. This is the matter for both women and men. For the whole duration of the trial, you should use and practice safe sex. In other words, when signing informed consent form, patient shall use contraceptions. Hospital physician will tell you about it in details. The other important idea to be mentioned is that informed consent form also informs patients about trial benefits and, of course, risks during the trial. It is a highly considerable issue because many modes of treatment used in trials can provide positive and notable results, but risks may also appear. Alternative methods of treatment are also provided in informed consent form. Patients are obligatorily informed about alternative treatment, about its effectiveness, and based on this information, a decision is taken whether to receive treatment with common drugs or with innovative drugs. All this is discussed with investigators. Information about contact person is provided in consent form. As a principal investigator, I can tell that if patient has a request to speak with me, he or she is free to do this. Hospital physician is patient's direct contact person. Patients can address to every hospital employee with any question, or if patient needs help. And believe me, patient will receive help or answer for any question. It is also important to understand that during clinical trial, patients will visit the hospital 4 or 5 times per month in average and spend from 3 to 7 days in hospital, sometimes more, but few days in general. The rest of the time, patients are out of hospital. We provide effective telephone contacts between patients and physicians, and patients can speak with the physician anytime. I will guarantee it. Patients will have physician's phone number, and these numbers are also provided in informed consent form in order to stay in contact 24 hours a day. But since patients spent 3 to 5 days in hospital, came to hospital in the morning to perform blood analysis, receive treatment, and leave the hospital in the afternoon, it is very important for us to receive contact information about their family doctors, domiciliary oncologists, patients' hospital contacts, because we have patients from other cities, from other regions of Ukraine, and patients may have some adverse events at home. Because of that, we ask each patient involved in clinical trial immediately inform family doctors or patients' domiciliary oncologists about his or her participation in clinical trial. and help us to connect with them in case it is necessary. We also need patients' contact phone numbers and phone numbers of patients' relatives in order to have a backup call. I hope our patients understand that clearly. Another interesting issue provided in informed consent tells what is happened if patient decided to withdraw the consent. As per international laws and requirements, patients have the right to refuse participating in trial and withdraw consent at any time. Such situation will not affect his or her rights. Patients have the right to withdraw consent or not to give any consent before signing informed consent form. Patients can receive alternative treatment if such decision is taken, or patients can receive treatment in other hospital or other physician. It means patients have always the right to say yes or no. But before taking any decision, we advise possible candidates to consult with our physicians. Because, as I mentioned, international clinical trials in oncology are performed in few hospitals in Ukraine. Physicians from common hospitals may not know everything about clinical trials. And it is known that one views unknown information with some skepticism if he is not aware about it. Patients shall know that they can receive different views when consulting with physicians from common hospitals. Patients have the right to discuss participation with anyone he or she wants. Please do not forget to discuss it with our physicians. Informed consent form explains any expenses arise during clinical trials. We know that oncologic treatment is expensive, and thus international clinical trials covers 97% of all expenses. Yes, it is absolutely true. International clinical trials are initiated and performed by sponsor company, and thus all expenses are covered by that sponsor company. Average costs of oncological treatment per month are estimated at $1,000. Namely, the received drug is the most expensive part in international clinical trials. And we understand that not everyone can afford this kind of highly effective treatment. Informed consent form has a special paragraph explaining who is responsible for clinical trial financing. Confidentiality and personal data protection is of high importance during international clinical trials. All patients' data is encrypted, and all data received during trial is provided in special systems with restricted and authorized access. Data is provided only to trial-involved partners. Patients give consent that his or her data will be protected, and after that will be provided to trial-involved hospital. Data includes patient personal data and medical records. As per Ukrainian legislation, we are obliged to protect confidentiality, and it is prohibited to give such data to third parties or other institutions without patients' personal consent. Informed consent has the checklist of all procedures and its frequency. Patients shall know from the beginning the name of procedure and procedure schedule. Such kind of procedure checklist provides a detailed information. And the last part is the sign-in page of informed consent form. Patients read and learn all about mentioned information. Patients understand each paragraph of the consent form and then voluntarily give consent. Representatives from the trial site, either principal investigator or delegated sub-investigators, signs the informed consent form. All this is a free-of-will agreement for international clinical trial participation, with all obligations included in the consent form. I tried to make a full and detailed explanation of informed consent signing process, because I think our patients need to know that we work in terms of international and Ukrainian legislation. None of the existing international company will carry on a cooperation if the law is not complied with. Thus, informed consent signing process and patient's voluntary decision is very important. We're sure that our patients will make a correct decision. We hope this decision will help our patients to fight the disease, and we, from our side, will support and make a great contribution to it. Thank you. Doctor of Medical Science, Professor, Head of the Department of Oncology and Medical Radiology, Igor Bondarenko, Dnipropetrovsk, Multi-Field Clinical Hospital, No. 4.